I have some important changes to go over with Medicare here in 2025. So we're going to start by going over the different parts of the Medicare, what comes from the government, what comes from private insurance companies, and how it all fits together. So getting started, the two parts that will come from the government. Number one, you have Medicare Part A. So Medicare Part A covers inpatient care in the hospital, covers hospice, skilled nursing, and then home health care also falls under Part A. The other part that comes from the government is Medicare Part B. Now, this helps cover outpatient services as well as services provided by a physician, both in and outpatient, durable medical equipment, and preventative care. Now, the way that these two parts kind of fit together, we'll touch on that. The Part D. Now, Part D, Medicare, a lot of times people think Part D drug coverage comes from the government, but Medicare sets what's called a standard model. And then the Part D drug coverage comes from private insurance companies. So the additional Medicare options, right? You can start with original Medicare, and then you can supplement original Medicare with a secondary insurance plan that comes from a private insurance company. A lot of times you see that referred to as Medigap, or you'll hear it referred to as a Medicare supplement, right? The other option is Medicare Advantage, or sometimes you hear that referred to as Part C. So we'll talk about how these are different. When you have a Medicare supplement, original Medicare is the primary payer. So what that means, you go to the doctor, you're going to give the doctor your Medicare card and the supplemental insurance card. So when you have a Medicare supplement, the insurance company is secondary. It doesn't necessarily matter if the insurance company is Blue Cross, Aetna, Humana, Bob's Insurance. Medicare is the primary payer. So you don't have to ask the doctor, do you take Blue Cross? Because as long as they take Medicare, the supplemental plan is going to pay. Okay. With the Medicare Advantage plan, now how this is different, when you have a Medicare Advantage plan, the insurance company is going to take over from Medicare as the primary payer. So when that's the case, you go to the doctor, you'll give the doctor the insurance company's card. You don't give them the Medicare card. Now, when that's the case, you do have a network. So then you do have to check, okay, does my doctor take the plan? Okay. So other differences that you'll see between the two, these Medicare Advantage plans, oftentimes you may see them advertised for very low to no cost. And oftentimes people will say, well, how can it be zero? And what's happening is when the insurance company is taking over as primary payer, Medicare is paying them an annual stipend to do that. So that's how they can offer these plans at very low to no cost. And typically you may see more out-of-pocket costs with a Medicare Advantage plan than you would with a Medicare supplement, meaning like you may have a copay at a specialist of like $30, or you may have a copay getting a complex imaging service like an MRI at maybe $200. But the trade-off is your premiums tend to be much lower. And they may offer other services. They typically will combine the medical and the prescription in one plan, whereas with a supplement, you're getting a separate medical plan. And if you wanted drug coverage, a separate Part D plan. The Advantage plans, oftentimes you'll also see them include dental and vision as well in the plans. So that's, kind of what they refer to as those extra benefits. All right. So Part A and who's eligible for Part A. So these are people that you're eligible at 65 or if you're disabled. Okay. And there's no premium for Part A as long as you've worked 40 quarters, which equates to 10 years of paying into Medicare tax. Okay. The way that Part A works. So again, these are the parts that come from the government. The Part A, if you're an inpatient in the hospital, you have a standard Part A deductible that's $1,676 per calendar year deductible. It's a per admission. So every time you go into the hospital, if you just had Medicare Part A, you'd be paying that $1,676 deductible. Okay. Now, once you've used up to 60 days of lifetime care, because Medicare Part A will cover 150 days of inpatient care lifetime. So once you get up to that day 61, then you start to pay a per day copay, which is $419 a day. And then once you get up to 90 days, when you're in excess of that 90 days, then you're paying that $838 a day. Medicare Part A will also cover skilled nursing. So the first 20 days, so skilled nursing, if you're an inpatient for 3 days, and then you're transitioned to a skilled nursing center, which is oftentimes like a rehabilitation center, then the first 20 days, you're not going to pay anything. Days 21 through 100, you'd have a $209.50 daily co-insurance. And then days 100 and beyond, Medicare doesn't cover that. And you oftentimes see a skilled nursing limit even on employer group plans that's up to 120 days. So that's pretty standard. Okay, so the Part B, there is a premium for Part B. Now, Part B, again, is the coverage for outpatient care and physician services. So the standard premium is $185 a month. Now, there are certain situations where people are going to pay more based on their income. That's what they refer to as IRMA, income related monthly additional adjustment. There's also a penalty if you don't sign up for Part B when you're first eligible. Now, a lot of times you'll hear about this penalty and people will think they have to sign up for Medicare when they're 65. That's not always the case, especially if you have coverage from an employer with over 20 employees. Okay. So yeah, again, this touches on that being part of an employer group plan. Now, these are the monthly income adjustments based on your your income from 2 years prior. So they always go in 2 years prior. It's a rolling 2 years. So you can see if you file a joint tax return, you're under 212,000, you're going to pay the standard rate of 185. If you're a single tax filer, 106 or less, you're going to pay the 185. But you can see how the Part B premium will increase up to a max of 628. Now, the Part B coverage, the way that's going to work, you have an annual deductible that's 257. So let's say I'm just on original Medicare. I go to the doctor. I'm going to get bills until they add up to 257. So I go to the doctor. I don't necessarily pay anything right then and there at the doctor's office. The doctor is going to submit the claim to Medicare. Medicare is going to come back and say, okay, well, this is what we would have paid for this service. Let's call it $80. You'd get a bill in the mail for $80, and you get these bills until they add up to 257. Once you get up to that 257, and then after that deductible is met, Medicare is going to pay 80%, and you're going to pay the other 20%. Okay, now there is something called excess charges. And this excess charge occurs if you go to a doctor that doesn't accept Medicare assignment, which, statistically, like 98% of doctors accept Medicare assignment. But let's say you went to one that doesn't, they could bill in excess of 15% of what Medicare would have paid for a service. So let's say Medicare would have paid $100, they can bill 115. And in some cases, you may be responsible for that excess charge. Now, there are 8 states where they have what's called Mom's Law, which is a Medicare overcharge measure where they cannot bill excess as well. So you may be in one of those states. And then again, plans from insurance companies can also cover that excess charge as well. Okay, so as you can see, if you just have A and B, there's no true out-of-pocket maximum on what you'd pay. So when you're trying to decide, okay, am I going to do a Medicare supplement or am I going to do a Medicare Advantage plan? Some things to take into consideration are obviously the monthly premiums. Like we talked about a little bit earlier, the Advantage plans, you're going to have a lower premium. The supplement, your premium is going to be higher. You could say that potentially you could have more access. This is not always the case, but with a supplement, because it is nationwide coverage, Medicare is the primary payer. You could see a doctor in Texas or Florida. So there's essentially no network when Medicare is the primary payer, as long as the doctor takes Medicare. The supplement is going to pay off the approved schedule of benefits. Now, a lot of Advantage plans, again, the Advantage plan is when the insurance company often will include the medical and the prescription in one plan. They will take over as primary payer from original Medicare. You do have a network. A lot of Advantage plans also do have national networks, but you just have to make sure that your provider is in network. And a lot of times someone's choice between a supplement or Advantage plan can be dictated by their area. Some areas have very robust, very good networks. Other rural areas, maybe not so much. Okay. So as you can see, with the Advantage plan, it's kind of like you're using one card. You're giving one card to the doctor, one card at the pharmacy. The plan includes dental and vision. Again, one card at the dentist and eye doctor. Okay. So we just want to take a step back and to iterate here with the Medicare supplement, the drug plan would be separate. And if you wanted dental and vision, that too would be separate. You're going to give the provider the original Medicare card, the supplemental card. You go to the pharmacy, you're going to give them the Part D prescription plan card. And if you had a separate dental plan, you'd give the dentist that dental card as well. So some important dates to keep in mind, like when you can enroll in original Medicare. Obviously, when you're turning 65, you have the 7-month window, 3 months before, 3 months after your birthday month. So annual dates, one thing to keep in mind that a lot of times people may get a little bit confused about with Medicare supplemental plans, there is no annual enrollment because technically you can change your Medicare supplement at any time of the year, but you have to get approved. So meaning you'd have to answer health questions or go through underwriting. Okay. These dates here, October 15th through December 7th, that is to change your Medicare Advantage plan or your drug plan or to switch to original Medicare. But it's not, it doesn't have anything to do with Medicare. So if you do make a new plan choice during that time, it's going to be effective January 1st. And then January 1st through March 31st, you have what's called a Medicare Advantage open enrollment, which you can change from one Medicare Advantage plan to another as well. So now for Medicare supplements, typically you can apply for Medicare supplement depending on the carrier up to 6 months before your Part B effective date, where you can lock in the rate, and then 6 months after as well. And like we touched on with the Medicare supplement, no matter what plan you choose, whether it's a supplement or advantage plan, you're going to pay your Part B premium. So you're always going to have A and B. So if you're in that uh, income range where you're going to pay 185 for Part B, you're going to pay that no matter what. So right off the bat, you're going to have that 185. And if you're taking Social Security, they'll take it out of your Social Security payment. If you're not taking Social Security, they bill you quarterly. Okay. So again, the supplements do not cover drugs. That for drug coverage, you can get a Part D drug plan that's offered through a private insurance company. Okay, guaranteed coverage. That's if you choose a Medicare supplement plan during your open enrollment, which is that 6 months where you don't have to answer health questions. Okay. Again, any doctor that takes Medicare is going to take the plan. Any hospital that takes Medicare is going to take the plan. All the coverage is standardized. Every company's Plan G is exactly the same. Every company's Plan N is exactly the same, for example. Now, the difference between insurance companies, this is important, is not only the initial price, but how they raise rates over time. So typically you want to choose a company that has a pretty stable base, meaning they have a lot of insured people. You'll see new companies come in to the market. They'll always have the lowest premium because what they're trying to do is entice enrollment. They hit their enrollment numbers. And then the next year, they're going to adjust the premium based on the loss ratio and among other things. They typically have higher increases year over year. So you want to choose a stable insurance company. So Part D, the prescription drug coverage. So there's been quite a few changes with the Part D drug coverage in 2025. They're usually going to have a premium. There's some cases where there's not a premium. The standard annual deductible is $590 per year. This is kind of set by that standard model. Now, some plans you can have a lower deductible and you may see a higher monthly premium. Oftentimes, you'll see the deductible waived for tier 1 and 2 drugs, which oftentimes tend to be a lower cost generics. A formulary. Formulary is just a list of the covered drugs on a plan. Oftentimes, you may see up to a 5-tier formulary on most plans. There can be a late enrollment penalty if you don't enroll when you first become eligible for Part D. Again, there are situations where this does not apply, like if you have coverage through an employer. Other things to keep in mind with the Part D drug coverage, especially this year, is there is an out-of-pocket max, which we'll touch on. You might have to go through what's called a prior authorization, where a doctor may say, well, this person needs this drug because of the efficacy of the drug, and you went and tried other drugs that didn't work the same. Now, for the formularies, every plan has to cover at least 2 therapeutic equivalents of every FDA-approved drug. So oftentimes people will say, well, what if my plan doesn't cover this drug that I may or may not need down the road? So we have that. There's going to be some therapeutic equivalents, and the doctor can also submit what's called a formulary exemption, which they can submit to the plan. Medicare could determine that the plan has to cover that drug based on the doctor's exemption as well. So there's usually a way to get your drug covered. So there's no more donut hole. So you may have heard about this donut hole when people are paying more for their drugs at certain times of the year. So that has been eliminated. There is a 2,000 cap on what you would pay for drugs over the course of the year. Now, oftentimes your cap may be less than 2,000 because this does take into account what you've paid plus what the insurance company has paid for the drug costs. There's also the implementation of a Medicare prescription payment plan. Now, this prescription payment plan allows you to spread the cost of your drugs throughout the calendar year. So if you have a very expensive drug where you may hit that 2,000 cap, let's say in January or February, you can enroll in the prescription payment plan through the insurance company that would essentially spread that cost and annualize it over 12 months. In a lot of situations, you may qualify for extra help. Now, extra help is usually based on income. This extra help is low income subsidy. These are 2024 numbers. There's also state prescription assistance programs as well, which oftentimes may have higher income limits that you can get help with drugs as well. Now, for low income subsidy, they're going to look at these forms of resources, but they don't count what's listed here as well. But some of those other state prescription assistance plans are strictly looking at adjusted gross income. Okay, to enroll in a Medicare Advantage plan, you must have original Medicare. So you have to have parts A and B, right? So you're gonna, like we said, you're gonna pay that Part B premium regardless of whatever your Medicare Advantage premium is. So right off the bat, if you're in that standard premium level of 185, you're going to pay that right off the bat. Most of these Medicare Advantage plans are going to include the medical and the drug coverage in one plan, as we have said. Okay, so different types of Medicare Advantage plans. Like if you're just turning 65, you've had coverage on your own as an individual or coverage through an employer. Like you may have heard some of these words before, like HMO, PPO. These are the different plan types where you're going to have a network. Like PPO is preferred provider organization. HMO is when you have a primary doctor, typically that acts as kind of a gatekeeper to facilitate care. Okay, so in review with original Medicare and a Medicare supplement, again, Medicare's primary payer. The supplement, no matter the insurance carrier, is going to pay off that Medicare schedule of benefits. You don't have to ask your doctor if they take your supplemental insurance carrier. As long as they take Medicare, that's all that you need to be concerned about. Medicare supplemental plans, they don't cover prescriptions. So if you wanted a prescription drug plan, you can enroll in a Part D plan administered by a private insurance company. Dental and vision are also separate, not included in the Medicare supplemental plan. Okay, so Medicare supplemental plans, you could say that you have lower potential out-of-pocket costs. Like when something happens, you may pay less. You may end up paying a couple $100 a year, depending on the type of plan you choose. Your monthly premiums are going to be higher with the Medicare supplement. The Advantage plans, again, the insurance company is often going to include the medical, the prescription, oftentimes dental and vision all in one plan. They're taking over from Medicare as the primary payer. Typically, your monthly premium is very low cost to no cost, and then you kind of have co-pays as you go along. Okay, so things to keep in mind. Obviously, budget. Another thing is access, meaning sometimes people will say, "Well, I want to see any doctor that I feel could treat me the best, no matter if they're located at MD Anderson in Texas or Sloan Kettering in New York. I never want to have to ask about a network. Paying higher premiums is worth the peace of mind. Maybe they lean towards a supplemental plan. Sometimes people will say, I don't go to the doctor that often. I can't really justify paying the higher premiums. I'd rather kind of save the money, and I'm happy with the access to the care I have in this particular area. So oftentimes they may lean towards a Medicare Advantage plan. They like how everything is kind of all in one card and it's administered by the insurance company. They don't have to keep track of different plans, different premiums. Yeah, so again, we touched on kind of, the drug formularies, the doctors, the network. A lot of Advantage plans are PPO plans that do have extensive networks. So sometimes your view on an advantage or supplemental plan may be skewed a little bit by what people say to you that may be friends or family members. But again, just keep in mind they may be in a different area. They may have a limited perspective as well. But things have changed quite a bit with Medicare here in the last 10 years. So more information, you can always reach out to us for help. It is good to talk to somebody. What we try and do is save our clients a lot of time and trying to help them with that initial decision. Your initial decision is very important because, like we said, options may be more limited down the road, depending on the enrollment periods in your area and whether you're choosing a supplemental plan or advantage plan. You can hit that subscribe button for more videos down the road as well, and we're always happy to help.